Hello, this is Kim McAllister, and this is the Windshield Survey. You're conducting a windshield survey in order to fulfill the experiential learning requirements for the Community Health Nursing course. The Windshield Survey is the initial tool that community and public health nurses utilize in order to assess a community. Remember that in community and public health nursing, the patient is the community. You have the opportunity to affect a greater number of lives and improve health on a much bigger scale when you work in community and public health. So in order to go assess your patient, you've got to get in the car and take a drive, which is not something you would do in a hospital setting. We recommend that you have someone with you. Either have someone record your observations while you drive, or have someone else drive for you while you make the observations and record those. We want you to be careful to observe all traffic laws and be careful as you go out, and we want you to be safe. So the objectives of the Windshield Survey are to utilize the nursing process to assess a community, to identify the steps of a windshield survey, conduct a windshield survey on a selected community, and then analyze the results, and then use this assessment to determine strengths and weaknesses on the community based on these results. You will be going through several other steps of the community assessment process after the windshield survey, and you will analyze all of the results together and develop your final conclusions and your community assessment nursing diagnosis. So in order to conduct a windshield survey, you're going to travel to your community that you're assessing and make those observations and record them. We recommend that you go several times a day, several times during the day. In other words, go different times of the day. Go in the morning, and then on another day, go in the afternoon, and then go in the evening, and go on a weekend and also on a weekday. This gives you a more comprehensive assessment. So in order to conduct the survey, you're going to drive through the community using an automobile or using public transportation. If there is a bus service available, that's a great way to conduct the survey. You can conduct your survey. You don't have to worry about driving or having someone else drive for you. And you can also speak with and talk with the people that are on the bus. And you can make some observations about public transportation while you're on it, such as what kind of condition is the public transportation in? How easy is it to get access to public transportation? Is it affordable? Does it go where people need it to go? All of these things are helpful to add to your survey. Using the Windshield Survey Guide, be sure to complete your observations and then submit the assignment. You do not have to use APA format. You're welcome to write either in sentences or in bullet points, whatever makes sense for you. You can either download the document and write directly on it, then scan it and upload it. You can make observations on a notebook or somewhere else and then fill those in on the document later and upload it directly to the web format. So as you're driving about, look at housing. What kind of houses do you see? Are there small houses, big houses? Are they well-maintained houses? Are they run-down houses? What is the availability of housing? Do you see a lot of for sale or for lease signs? Do you see new construction? Are the houses relatively new? Are they old? Is there a mix? Next, look at the roads. What is the condition of the roads? Are they well maintained? Are they run down? Are they broken? Do you see a lot of potholes? Are there gravel roads, paved roads, dirt roads? Is there an interstate nearby? Is there a major highway through your community? What about businesses? Are there a wide variety of businesses? Do you see a lot of empty storefronts with for sale or for lease signs or going out of business signs? Do you see businesses that are conducting a brisk trade? Do you see a lot of people going into and out of businesses? Are there meeting places? Are there parks? Are there community centers? Are there senior adult centers? What kind of areas do you see where people can meet? Are there restaurants? Are they just fast food? Do they have healthy food? Are there grocery stores, or does the community rely on convenience stores? If there aren't any grocery stores available, how far do people have to go to get to them? Are there parks and recreational areas? Are people using them? What kind of condition are they in? How available are they? Are they open all the time? Are they open when people are off work? Do you see people walking around taking walks or exercising? Are there gyms? Are there other places for people to exercise? Are there any other type of interesting buildings or objects that pertain to your community that you want to record? What about access for the disabled community? Are there ramps? Are there automatic doors? Can people access the sidewalk? Take a look at the people and note what types of races and ethnicities that you see. Are there any other specific types of people groups that you see? Are there a lot of children or elderly people, middle-aged people? Do you see men? Do you see women? Do you see both? I'll note down all the different types of people and things about the people that you see. If it's safe to do so, get out and talk to people and ask them about their community. Let them know who you are and what you're doing, and ask them some questions. What about healthcare? Have you noticed any hospitals or clinics? Are there any urgent care centers or emergency rooms, freestanding emergency rooms? What types of clinics do you see? Are there free clinics or low-cost clinics? If there isn't any health care, how far do people have to go to access it? What kind of services are provided at the different areas of health care? And in order to do this, it's a really good idea to get out and go in and ask. Again, identify yourself and what you're doing and just ask questions. What about the transportation? What kinds of public transportation do you see? How are people generally moving around the community? Are they walking? Are they biking? Are they driving their cars? What kinds of transportation do you see? Are there taxis? Is there a bus service? And what are the conditions of the road? What types of law enforcement do you see? Are there police stations? Are there fire stations? Are the fire stations volunteer or are they municipal owned? What kind of hazards do you see in the community? Are there areas that don't appear safe? Please don't go to any unsafe areas during your survey. Do you see broken roads, broken sidewalks? Are there street lights that aren't working? Do you see anything else that could be dangerous? Communication. How is information shared and disseminated into the community? Are there local bulletin boards? Are there billboards? Do you see a newspaper? Is there a local newsletter for the community? Is there an online billboard or online newsletter? Are there banners? Do you see banners over the roads or on buildings? And what kind of information is on the bulletin board? Do you see that there are a lot of activities in the community? Ask people how they find out about events in the community. Do you see any schools? If there aren't any schools in the community, how far do people have to go to reach them? What kinds of schools do you see? Are there kindergartens? Are there preschools, elementary schools, middle schools, junior highs, high schools? Do you see any higher education? Are there community colleges? Are there four-year colleges? What types of recreational areas do you see? Are there parks and playgrounds? Who's using them? What kind of condition are they in? Are they free? Do people have to pay for them? Are people actually using them? If it's safe to do so, get out of your car and ask people a few questions. Again, identify yourself and ask them why you're asking questions. What are the strengths of the community? What do they like about their community? How long have they lived there? Why did they move there? What are the weaknesses? What kind of things would they like to see changed? What sort of things do they not like about their community? Are there any interesting facts or historical events that have happened in their community? After you've asked these questions, sum up their responses. After you conduct the survey, remember to go back a couple of other times, at different times of the day and different days of the week. Based on what you have found from what people have told you and from your own personal observations, identify the strengths and the weaknesses of the community. Also take a moment and think about the differences between assessing a patient and assessing a community. And remember, the community is your patient. This concludes the first step of the community assessment process. Next, we'll conduct a demographic assessment where we will look up and research data about the community. You're going to put all of this information together to finalize and produce a final community assessment project.